Welcome back, everyone. Ready for another deep dive?
Always.
Awesome. So today we're going to be tackling a pretty fascinating subject, uh, the complex world of children's health,
Okay.
specifically the ways in which a child's physical health can actually be intertwined with their mental well-being,
Sounds interesting.
right?
Yeah.
And for this deep dive, we're going to be drawing our insights from a really intriguing chapter
Yeah.
in a child psychopathology textbook, which I know you're familiar with.
Yeah, I've read that one. It's pretty good.
Yeah, I was really struck by how it blended historical perspectives with like modern medical knowledge.
Mm-hmm.
And then it even includes some like really compelling real life case study.
Oh, yeah. Those always help.
Right. Yeah, they definitely bring the concepts to life.
Yeah, it's like a detective story, isn't it?
Yeah.
Tracing how, our understanding of these issues has evolved over time. And what's really remarkable is that these insights have profound implications for how we approach child health and development, both individually and as a society.
That's such a great way to put it. Like what really jumped out at me early on in the chapter was that tendency
Mm-hmm.
historically to misattribute physical symptoms in kids to psychological causes.
Right.
It's almost hard to believe some of the assumptions they made back then.
I know, right? Imagine thinking bedwetting
God.
was a sign of stubbornness.
Oh, no.
They even had these contraptions, iron yokes to prevent children from, urinating at night.
It's wild.
Talk about a misinterpretation of the problem.
Really is, yeah.
Yeah.
It's incredible how far our understanding has come. Like now we know that primary enuresis, which is the most common type, is likely linked to genetics.
Right.
The chapter mentions that there's like a strong familial pattern.
Uh-huh.
So it's not about the child's like willpower or personality at all.
Exactly. And it's a relief that we've moved past, those kind of misguided interpretations.
Definitely.
Speaking of shifting perspectives, the chapter also brought up the groundbreaking ACE study.
Oh, yeah. Which stands for Adverse Childhood Experiences. And this one's a real game changer
Is.
in how we understand the ways early trauma can actually impact long-term health.
Absolutely. That study really opened our eyes to the prevalence of childhood trauma and how those early experiences can have a ripple effect throughout a person's life.
Huge.
It's not just about immediate psychological distress, but also about increased risks for chronic diseases, mental health struggles, and even substance abuse later in life.
Right.
Makes you really think about the importance of early intervention and support for children who have experienced trauma.
Absolutely. The ACE study really highlights, the crucial need for prevention and early intervention. Now,
Yeah.
switching gears a bit, let's talk about something that's absolutely essential for all of us,
Okay.
especially for growing children.
Oh, yeah. We all need that.
Right. So the chapter dives deep into the world of sleep.
And its critical role in child development. Did you know that by the age of 2, a child has already spent almost 14 months asleep?
Wow, 14 months. That's incredible.
It is.
That's more time than they've spent doing just about anything else at that age.
Right.
It really puts into perspective, like, just how important sleep is
Yeah.
for their developing brains.
Right. And what's interesting is that the connection between sleep and mental health,
Right?
it's a two-way street.
Oh, interesting.
Sleep difficulties can actually contribute to mental health issues
Okay.
and vice versa.
It goes both ways.
It does. The chapter compares a child's brain to a large orchestra
Okay.
that needs to retune during sleep.
Okay.
And without that crucial downtime, the music suffers
Yeah.
and the brain doesn't function optimally.
That analogy really makes it clear why sleep is so vital.
It does, doesn't it?
Yeah. Now, I found it helpful how the chapter broke down the different types of sleep disorders, like dysomnias and
Yes.
parasomnias.
Right. Dysomnias are basically problems with the timing, the duration, or the quality of sleep.
Okay.
So think of insomnia where someone has trouble falling asleep or staying asleep, or hypersomnia, which involves excessive sleepiness,
Right.
and narcolepsy, which is characterized by those sudden sleep attacks.
Okay.
That also falls under this category.
So dysomnias are essentially about the amount and quality of sleep or lack thereof.
Yes, exactly.
Okay. What about parasomnias? I remember reading that those involve like unusual behaviors or experiences during sleep.
Right, exactly. So parasomnias are those, strange things we sometimes do while we're sleeping.
Okay.
You've got nightmares, sleepwalking, and sleep terrors.
Right.
Those are kind of the classic
The
examples.
classic ones, yeah.
You might have also heard of sleep talking,
Mm-hmm.
confusional arousals, where someone wakes up disoriented,
Oh.
and even sleep-related eating disorder, which is thankfully quite rare.
Yeah, I'm glad that one's rare.
Me too.
It's fascinating, though, like how diverse these sleep issues can be.
Yeah.
The chapter does mention that diagnosing sleep disorders in young children
Mm-hmm.
can be particularly tricky because their sleep patterns are still evolving.
Yeah.
What might seem like a disorder can just be a phase they're going through, right?
Exactly. That's an important point.
Yeah.
We need to be cautious about jumping to conclusions.
Right.
However, if these sleep difficulties persist or they're causing, significant distress for the child or the family,
Yeah.
it is important to consult with a healthcare professional
Right.
to rule out any, underlying medical or psychological issues.
So it's all about striking that balance, right?
Yeah.
Between careful observation
Yes.
and seeking professional guidance.
When needed.
Exactly.
Exactly.
The chapter does offer some helpful insights into treatment options for sleep problems.
Yeah.
So I'm curious, what are some of the key approaches?
Well, behavioral interventions are often the first line of treatment.
Yep.
Establishing good sleep hygiene is crucial.
Mm-hmm.
This involves creating a consistent bedtime routine, setting regular sleep and wake times,
Okay.
and making sure the sleep environment is, comfortable and conducive to sleep.
Makes sense.
The chapter even mentions specific techniques like full spectrum home training for bedwetting,
Oh, yeah.
which involves a combination of behavioral strategies
Like,
to help children gain bladder control.
now, I also remember reading about the use of melatonin supplements
Yes.
to help regulate sleep cycles.
Hmm.
Is that something you would recommend?
Melatonin can be helpful in some cases,
Okay.
especially for children who have trouble falling asleep.
Hmm.
However, it's really important to use it under the guidance of a healthcare professional,
Right.
as the appropriate dosage can vary
Yeah, of course.
depending on the child's age
Right.
and their specific sleep issues.
Good advice.
Yeah.
Seems like we've already covered a lot of ground
We have.
from those historical misattributions of physical symptoms to the complexities of these sleep disorders.
Definitely. And you know what? We've only just scratched the surface of this fascinating chapter.
I was going to say,
Yeah.
there's so much more.
I know. From elimination disorders to the challenges of chronic illness,
Right.
and even the ever-important topic of substance use in adolescence.
Oh, yeah.
There's a wealth of insights just waiting to be explored.
You've definitely piqued my curiosity. I'm ready to dive even deeper into these topics
Me too.
and unpack all this valuable knowledge that this chapter has to offer.
Let's do it. I think our listeners are going to find the upcoming discussions
Yeah.
both enlightening and empowering.
I think so, too. I'm looking forward to it.
Yeah, me too.
This is going to be good.
It is.
All right, so moving on to something that might be a little less comfortable to talk about,
Okay.
but is equally important.
Yeah.
The chapter also delves into elimination disorders.
Right?
I'm talking about enuresis, which we already touched on,
Yeah.
and then encopresis, which involves issues with bowel control. And, these disorders can be really tough
Yeah.
for both the child and the family
Absolutely.
to deal with.
It's true. These conditions can be quite distressing, but it's crucial to remember that they are not the child's fault,
God.
despite some of those, I guess you could say, wild historical cures we talked about earlier.
Yeah.
We now understand that these disorders are often rooted in physiological factors.
Right. It's amazing how far we've come from iron yolks and things like
It's
that.
unbelievable, right?
Can you talk a little bit more about the modern understanding of the causes of enuresis and encopresis?
Sure. So with primary enuresis, which is when a child has never achieved consistent bladder control,
Right.
genetics seems to play a big role.
Okay.
Like we mentioned before, it often runs in families.
Huh?
On the other hand, encopresis, or soiling accidents, frequently stem from chronic constipation and avoidance behaviors, related to using the toilet.
So while the root causes often are physical, it seems like there can be a pretty significant psychological impact as well.
Yeah.
I imagine these disorders can lead to like feelings of shame,
Right.
social stigma, and even potential misunderstandings from parents who might not fully grasp the situation.
Yeah, you hit the nail on the head. The emotional toll on these children can be substantial. And unfortunately, it's, sometimes compounded by a lack of understanding or inappropriate reactions from those around them.
That makes a lot of sense. So what are some effective treatment options for these disorders?
Okay. Well, for enuresis, one of the most effective methods is using a urine alarm.
Oh, okay.
It's a simple device that wakes the child up when it detects moisture, helping them learn to associate the sensation of a full bladder with waking up.
So it's like a conditioning thing.
Yeah, exactly.
Okay, yeah.
There's also dry bed training, which involves a structured program of positive reinforcement and gradually increasing the time between bathroom breaks.
So it's about like helping the child develop awareness and control over their bladder function.
Exactly.
Gotcha. What about encopresis? Are there similar behavioral approaches for that?
With encopresis, treatment usually involves a combination of medical and behavioral interventions.
Okay.
First, it's important to address any underlying constipation.
Right.
This might involve dietary changes, medication, or other strategies to, get things moving, so to speak.
Try to get things flowing.
Yeah, exactly.
And then once the constipation's under control, I imagine the behavioral side of treatment comes in.
Right, exactly. This might include establishing regular toileting routines, using positive reinforcement for successful bowel movements, and addressing any anxieties or fears the child might have about using the toilet.
So it sounds like a multifaceted approach is really key for both of these disorders.
Yes, definitely.
And speaking of complex medical situations, let's move on to another important area that the chapter covers, chronic illness.
Right.
The chapter highlights how conditions like diabetes and childhood cancer can be incredibly stressful, not just for the child, but for the whole family.
It's true. It's important to recognize that chronic illness, it impacts the entire family system. It's not just about, managing the medical aspects, but also about navigating the emotional, social, and practical challenges that that inevitably arise.
The chapter uses the stories of two children, Amanda and Chen, to illustrate these challenges.
Right.
Amanda is a teenager living with diabetes. And Chen is a young boy battling leukemia. And hearing your experiences in their own words is, it's truly eye-opening.
It is. Their stories highlight the fact that chronic illness, it's not a one-size-fits-all experience.
Right.
Each child, each family will cope and adapt in different ways. Some, exhibit remarkable resilience, while others might struggle more with the emotional and behavioral aspects of their condition.
So let's delve a little deeper into the specifics of these two conditions. First, diabetes. I imagine it's incredibly challenging for a child to manage the daily demands of this illness.
Absolutely.
The constant monitoring, dietary restrictions, insulin injections.
It's a lot to handle, especially for a child or a teenager who's, still developing their sense of independence and identity.
Right.
And the stakes are high.
Yeah.
Maintaining good metabolic control, keeping those blood sugar levels within a healthy range is crucial for preventing long-term complications.
The chapter mentions that regimen adherence, basically following the doctor's orders, is key to achieving that metabolic control.
Right.
But I can imagine that can be incredibly tough, especially during adolescence, when
Yeah.
there's so much pressure to fit in and rebel against authority.
You're absolutely right.
Adolescence is already a time of intense physical, emotional, and social changes. Adding the burden of a chronic illness like diabetes can make it even more difficult for teenagers to stay on track with their treatment.
It's true.
So it sounds like supporting a teenager with diabetes requires a delicate balance of understanding, encouragement, and firm guidance.
Yeah, it really does.
Now, shifting gears to childhood cancer.
Okay.
It's hard to even fathom the emotional roller coaster these families go through.
It is. It's a truly devastating experience.
Yeah.
The diagnosis alone is a heavy blow.
Yeah.
Followed by, the grueling treatments, the uncertainty of the prognosis, and the constant fear of relapse.
And even for those fortunate enough to survive, the chapter points out that childhood cancer can have lasting impacts, including a higher risk of serious illness in adulthood.
Right. This underscores the importance of providing comprehensive support to these families, not just during treatment, but also throughout survivorship.
Yeah.
They need help navigating, the physical, emotional, and social challenges that can arise long after treatment has ended.
So how do we make sense of all these factors that influence a child's adaptation to chronic illness?
Well, the chapter mentions something called the transactional stress and coping model.
Okay.
which seems like a useful framework for understanding this, this complex process.
Can you break that down for us a little further?
Sure. The transactional stress and coping model emphasizes that adaptation is a dynamic process,
Okay.
not a static outcome.
Okay.
And it highlights how a child's adaptation is shaped by a complex interplay of factors.
So what are some of those key factors?
Well, the model considers things like the specific illness parameters,
Okay.
meaning the severity of the illness, the type of treatment required, and the prognosis.
Mm-hmm.
It also looks at the child's individual characteristics,
Okay.
such as their temperament, their coping skills, and their social support network.
So it's not just about the illness itself, but also about the child's unique personality
Right.
and the resources they have to draw upon.
Precisely. And it also considers family functioning, including the quality of parent-child relationships, communication patterns, and the family's overall coping style.
So it really does take a holistic view of the entire family unit.
Yes, exactly.
Yeah.
And finally, it acknowledges the role of broader social support, including extended family, friends, and community resources.
It sounds like a very holistic approach, recognizing that a child's adaptation to chronic illness is influenced by a whole web of interconnected factors.
Exactly. And this model is crucial because it helps us understand why some children thrive despite facing, tremendous challenges, while others might struggle more.
It highlights the importance of tailoring interventions to each child's unique needs and circumstances.
Yeah.
Recognizing that there's no one-size-fits-all approach.
Right. Now, moving into the final stretch of our deep dive, let's shift our focus to another crucial topic: adolescent substance use disorders.
This is such a relevant,
it is
and unfortunately increasingly common issue.
Yeah, so true.
The chapter acknowledges the alarming prevalence of substance use among teenagers.
Right.
And delves into the various risk factors involved.
It's essential to understand that substance use during adolescence.
Yeah.
It can have serious consequences, both in the short term and the long term. It's not something to be taken lightly.
The chapter clarifies the DSM-5-TR criteria for diagnosing these disorders, emphasizing the need to look for a problematic pattern of use that's causing significant impairment in the adolescent's life.
Exactly. It's not just about, how often they're using a substance, but about the impact that use is having on their relationships, their schoolwork, their physical health, and their overall well-being.
So what are some of the key factors that contribute to adolescent substance use? The chapter mentions early age of onset as a major predictor.
Yes, the earlier a teenager starts using substances, the greater their risk of developing a substance use disorder later on. Early intervention is crucial.
Yeah.
We need to interrupt those patterns before they become deeply ingrained.
The chapter also points out the role of sensation-seeking tendencies.
Right.
Teenagers are naturally inclined to explore and take risks.
Yeah.
Which can make them more susceptible to experimenting with substances.
And let's not forget about family history.
Right.
Adolescents with a family history of substance abuse, particularly alcoholism, are at increased risk. Both due to, genetic predisposition and environmental influences.
Right. It's that classic nature versus nurture interplay.
It is.
Speaking of nurture, the chapter also highlights the significant impact of family dynamics and peer influence.
Absolutely. Family factors like poor communication, lack of parental monitoring, and conflict can create a breeding ground for substance use. It's not about blaming parents, but about recognizing the powerful influence of the family environment.
If a teenager feels unheard or misunderstood at home,
or
if there's a lack of connection or support, they might be more likely to seek solace or escape in substances.
Exactly.
And then you've got the infamous peer pressure.
Oh, yes.
It's the classic teenage struggle.
It is.
That feeling that everyone's doing it, so why shouldn't I?
And as we mentioned earlier, that perception is often based on a false consensus.
Right.
Teenagers often overestimate how many of their peers are actually using substances.
Yeah.
But that doesn't make the pressure any less real.
Right. It's still very real for them.
It is. And let's not forget about, the role of media and popular culture.
Oh, right.
Which often glamorize substance use, making it seem cool, rebellious, or even glamorous. It's a tough message to counter.
It is.
Especially when teenagers are already, grappling with so many insecurities, social pressures, and hormonal changes.
So with all these factors at play, what can we do? What are some effective approaches to both treatment and prevention?
Well, the chapter outlines several promising strategies.
Okay.
Let's start with treatment.
Okay.
One size does not fit all.
Right.
So it's crucial to tailor interventions to each teenager's, unique needs and circumstances.
Yeah.
Family-based interventions have shown a lot of promise.
Family-based interventions, what are those like?
These interventions recognize that the family plays a crucial role in a teenager's recovery.
Okay.
They focus on improving communication, strengthening relationships, and setting clear boundaries.
Yeah.
It's about, creating a supportive environment where the teenager feels heard, understood, and empowered to make positive choices.
It sounds like it's about shifting the family dynamic from one of conflict and secrecy to one of, open communication and collaboration.
Exactly.
The chapter also highlights motivational interviewing.
Yes.
As a promising approach for treating substance use disorders.
It is.
I'm intrigued by this concept of motivational interviewing. How does it work in practice?
Well, it's a non-confrontational method that helps teenagers explore their own ambivalence about substance use. And motivates them to change their behavior. It's not about lecturing or dictating what they should do, but about guiding them toward their own solutions.
So it's about empowering teenagers to take ownership of their recovery.
It's about tapping into their intrinsic motivation for change.
Well, let's talk prevention.
Okay.
As with most health issues,
Yeah.
the earlier we intervene, the better.
Absolutely. The chapter emphasizes the importance of comprehensive prevention programs that target multiple levels of influence, not just the individual teenager, but also family dynamics, peer groups, school environments, and community norms.
So it's about creating like a culture of support and healthy choices that surrounds teenagers with, with positive influences. And equips them with the skills they need to resist temptation and make wise decisions.
Exactly. The chapter mentions a specific program called Life Skills Training, which has been well evaluated and shown to be effective in reducing substance use among teenagers.
What does Life Skills Training involve? What kind of skills does it teach?
Life Skills Training is a comprehensive program that teaches teenagers practical skills for resisting drug use, managing stress, communicating effectively, and building healthy relationships.
So it really gives them a whole toolkit of strategies for navigating the challenges of adolescence.
It does.
Wow, it sounds incredibly comprehensive.
It is. And it recognizes that prevention isn't just about, saying no to drugs. It's about equipping teenagers with the knowledge, the skills, and the confidence to make healthy choices across all areas of their lives.
Okay, so we've talked about how serious adolescent substance use is, but you know what? There are a lot of myths and misconceptions floating around out there.
Yeah, there are.
And this chapter actually does a great job of debunking some of those common myths. One that I hear all the time is that it's just a phase, like all teens experiment. And they'll grow out of it.
Yeah, you hear that a lot.
Yeah, but is that true?
Well, it's a dangerous assumption to make. While some experimentation might be common, it's not something to dismiss lightly. The reality is that early substance use, especially during the teen years, significantly increases the risk of developing, a full-blown substance use disorder later in life.
So it's not something to just brush off?
No, not at all.
Okay. And I think another misconception is that certain drugs are harmless.
Oh, yeah.
You hear people say things like, oh, marijuana is just a plant. It can't be that bad.
Right.
What do you say to that?
Well, that's a myth we need to bust right away.
Okay.
The chapter makes it clear that any substance, whether it's, derived from a plant or synthesized in a lab, can have negative consequences if it if it alters mood, perception, or brain function.
So it doesn't matter where it comes from.
No.
It's the effect it has.
Exactly. And this is especially true for a developing brain. like that of a teenager.
What about the idea that addiction is a choice?
Oh, that's a tough one.
You often hear people say things like, they just need to get stronger, they need more willpower.
Right.
Is it really that simple?
That's a harmful and inaccurate view of addiction.
Okay.
Addiction is a complex disease, not a moral failing.
Okay.
It involves changes in brain chemistry and neural pathways that make it incredibly difficult to control substance use, even when faced with, severe consequences.
So it's not just a matter of willpower.
No, not at all.
Okay. So we've tackled some of the myths.
We have.
Now let's dive into the factors that actually influence adolescent substance use.
Okay.
We've already talked about early age of onset,
right,
sensation-seeking tendencies, and family history. But the chapter also emphasizes the role of environmental factors.
It does.
Particularly family dynamics and peer relationships.
Absolutely. These environmental influences can be incredibly powerful, shaping a teenager's choices and behaviors. So let's start with families. The chapter points out that factors like poor communication, lack of parental monitoring, and ongoing conflict within the family can create a breeding ground for substance use.
Yeah, and it makes sense when you think about it. If a teenager feels unheard or misunderstood at home,
right,
there's a lack of connection or support, they might be more likely to seek solace or escape in substances.
Exactly. And if there's a lack of parental monitoring, if teenagers feel like, they can get away with anything, they're more likely to engage in risky behaviors, including, experimenting with substances.
Right. And then there's the infamous peer pressure.
Oh, yes.
It's the classic teenage struggle, that feeling that everyone's doing it, so why shouldn't I?
And as we mentioned earlier, that perception is often based on a false consensus.
Right.
Teenagers often overestimate how many of their peers are actually using substances.
Yeah.
But that doesn't make the pressure any less real.
No, it's still very real for them.
It is.
The chapter also mentions how substance use is often glamorized in the media.
Oh, absolutely.
Teenagers are bombarded with these images and messages that portray substance use as cool, exciting, and even rebellious.
It's a tough message to counter, especially when teenagers are already, grappling with so many insecurities, social pressures, and hormonal changes.
So with all these factors at play, what can we do? What are some effective approaches to both treatment and prevention?
Well, when it comes to treatment, it's crucial to remember that one size does not fit all.
Right.
Every teenager is unique, and their treatment plan needs to be tailored to their individual needs and circumstances.
Okay.
The chapter highlights family-based interventions as being particularly effective.
I'm curious to learn more about these family-based interventions. What do they entail?
Well, family-based interventions recognize that the family plays a vital role in a teenager's recovery. These interventions focus on improving communication within the family, strengthening relationships, and establishing clear boundaries and expectations.
So it's about shifting the family dynamic from one of conflict and secrecy to one of, open communication, support, and accountability.
Exactly.
Okay. The chapter also mentions motivational interviewing as a promising approach for treating substance use disorders.
It is.
I've heard about this technique before, but I'm not entirely sure how it works. Could you explain it a bit further?
Sure. Motivational interviewing is it's a collaborative and non-confrontational approach that helps teenagers explore their own ambivalence about substance use. It's not about lecturing or telling them what to do, but about guiding them toward, recognizing the negative consequences of their choices.
Right.
And empowering them to make positive changes.
So it's about tapping into their own intrinsic motivation for change.
Exactly.
Rather than imposing external pressure.
Exactly.
Okay, that makes sense. And now shifting gears to prevention.
Okay.
The chapter emphasizes the need for comprehensive programs that target multiple levels of influence.
Right.
So not just focusing on the individual teenager, but also addressing family dynamics, peer groups, school environments, and even community norms.
Absolutely.
Okay. It's about creating a culture of support and healthy choices that surrounds teenagers with positive influences and equips them with the skills they need to resist temptation and make wise decisions.
Exactly. One program that the chapter highlights is called life skills training.
Oh, I'm intrigued by this life skills training program. What makes it so effective?
Well, life skills training is A comprehensive program that has been extensively studied
Okay.
and shown to be very effective in reducing substance use among teenagers.
Oh, that's great.
It teaches teenagers practical skills for, resisting drug use,
Yeah.
managing stress, communicating effectively, building healthy relationships, and making responsible decisions.
So it really gives them a whole toolkit of strategies
It does.
for navigating the challenges of adolescence.
Exactly. And it recognizes that prevention isn't just about saying no to drugs.
Right.
It's about equipping teenagers with the knowledge, the skills, and the confidence to make healthy choices across all areas of their lives.
This has been an incredible deep dive. We've explored so much.
We have.
From historical misconceptions about children's health to the complexities of sleep disorders, the challenges of chronic illness, and this ever-important topic of substance use in adolescence.
Yeah, it's been a real journey of discovery.
And what's really striking to me is how interconnected all these issues are.
It is, isn't it?
We can't look at a child's physical health in isolation from their mental well-being.
Right.
And we can't ignore the powerful influence of family, peers, and, the broader social environment.
It's all connected.
It really is. And what I found especially heartening is this emphasis on resilience. The chapter really highlights the incredible capacity of children to adapt, to cope, and even to thrive in the face of adversity.
It is remarkable, isn't it? Their resilience is just, it's inspiring.
It really is.
Yeah.
And it reminds us that our role as adults is to create an environment where that resilience can flourish.
Absolutely.
To provide children with the love, support, understanding, and resources they need to navigate challenges and reach their full potential.
Couldn't have said it better myself.
Well, we hope this deep dive has provided you, our listener, with valuable insights and practical strategies for supporting the children in your life. This chapter we've explored is just one starting point.
It is.
There's a wealth of information out there.
Absolutely.
Just waiting to be discovered.
So keep learning, keep questioning, and never underestimate the power of a supportive and nurturing environment to shape a child's life.
Well, thank you so much for joining us on the deep dive. Until next time, stay curious and stay engaged.